Hello, this is Dr. Ho. We're going to talk about and analyze a hypertension, this common chronic medical condition that is very important to understand the physiopathology and how involved your patient, your client in safety exercise program designs. And for that, we have some recommendation, training tips, recommendation, general recommendation, accurate blood pressure assessment, pre-participation screen, coexisting condition, and post-exercise hypertension. We're going to check it one by one. Some general information and training tips about this disease is when working with clients or patients with hypertension, especially consideration should be always be given to the level of blood pressure control is important. Recent change in antihypertensive drug therapy, medication related to adverse effects, the presence of target organ disease, other comorbidities of your patient, and the age. Now we're going to move to how to accurate blood pressure assessment. And in here, to accurate blood pressure assessment is critical for the initial diagnosis and to establish a baseline of blood pressure to properly evaluate the influence of lifestyles intervention strategy across time. And it's important when you are going to assess the blood pressure, avoid at least 24 hours before the blood pressure assessment some factors like caffeine, like smoking, and other factors that can affect the reliability of the value. But prior to the first reading, the client or the patient should be seated quietly and not talking for at least 5 minutes. Legs uncrossed and flat on the door, the floor, sorry, your feet, bladder empty, back supported upright, arm supported at the level of the hip level, with an appropriately side cuff. About the pre-participation screen, the ACSM provides a guidelines and emphasizes a public health message that exercise is important for individuals with this condition, such as individuals with hypertension clear to exercise by pre-participation algorithm or their healthcare provider should be encouraged to progress gradually, avoiding large increase in any of the component of the frequency, intensity, time, and type. And progression should be by increasing exercise duration over the first 4 to 6 weeks, following by increasing frequency, intensity, keep the recommended volume of 150 minutes week, or 700 to 2000 kilocalories over the next 4 to 8 months. And progression should be individualized based on tolerance and preference in a conservative manner. Other is than usually, that's frequently, than hypertension people have coexisting condition. For example, individuals with hypertension are often overweight or obese, and several of researchers have developed a novel clinical decision support system prescribed by exercise, and is prioritized, personalized, prescribed exercise, the P3X than we analyze in the past classes, the past lesson. This is for patients with multiple CVD risk, cardiovascular disease risk factors, founded upon the evidence-based recommendation of the ACSM and the American Heart Association. And Other factor in here is that the blood pressure lowering effect of aerobic exercise are immediately a psychological response refers to as post-exercise hypertension, and your patient should be made aware of post-exercise hypertension and instructed how to modulate its effect. Example, continue very light intensity exercise or cool down, such as slow walking as opposite to abruptly stopping, and it's important slow cool down. And exercise, more exercise recommendation about this, then generally intensity recommended optimize the benefit to risk ratio. And exercise testing and vigorous intensity exercise training for individuals with hypertension and moderate to high risk for cardiac complications should be medical supervision until the safe of prescribed activity has been established. And here that means that although vigorous intensity aerobic exercise, more than 60% of the VO2 max, is not necessarily contraindicated in individuals with hypertension. Moderate intensity aerobic exercise like 40 to 59 of the VO2 max is generally recommendation to optimize the benefit. And other factor in here about hypertension is some cases an exercise test may be beneficial to establish the exercise heart rate corresponding to the exaggerated blood pressure in this individual. And an exaggerated blood pressure responds to relative lower exercise intensity at higher rate levels less than 85%. And it's advised to maintain systolic blood pressure less than 220 and diastolic blood pressure less than 105 or 105 when exercising. Other consideration we have in here about the type. Breathing is important. Inhalate and breathe holding while engaging the actual lifting of a weight. A Valsalva maneuver is contraindicated in here, can result in extreme high blood pressure response, dizziness, or even fainting. It is important breathing during the weight lift to prevent this condition, and don't use heavy weights. And other factor in here about exercise, whenever possible, any interdisciplinary collaborative approach is important, involving the patient, healthcare provider, and exercise professional will help to improve lifestyles and pharmacological adherence, and this is important for the treatment of hypertension. We have in here common prescribed medication for hypertension. We had two classification: first line agent and second line agents. For this is antihypertensive therapy, varies of the blood pressure threshold, and for many adults with high blood pressure, pharmacotherapy requires more than one agent or a combination of blood pressure medication, and there's too much medication about it. But let's check then we can see here the first line agent. 4 classes of anti-hypertension drugs are recommended at the first line agents to treat hypertension. Those are, as you can see in the screen, thiazide or thiazide type diuretics, IC inhibitors, calcium channel blockers, and the second line agents. 6 general classes of antihypertensive drugs are recommended as a second line agents. Are more in here: alpha 1 blockers, beta blockers, direct renin inhibitor diuretics, and This for many adults, as we said before, with high blood pressure, maybe they requires more than one. Maybe they are taking a combination of first line agents and second line agents, and we're going to go in here for special consideration, uh, thermoregulation, hypoglycemia, exercise capacity, post-exercise blood pressure. Let's start with the thermoregulation. And in here is that beta blockers and diuretics may adverse effect of thermoregulation. The first line agent, the second line agent drugs, and you need to educate your clients about signs and symptoms of heat illness, and be careful when you are working with this population in your fitness facility. So it's important the thermoregulation in this population. Other fact is the hypoglycemia, because beta blockers may also increase the risk of hypoglycemia. It's a low blood glucose, and you need to educate clients, educate your patient about the signs and symptoms of hypoglycemia and precautions to avoid it. So it's important because some medication as can have a secondary effect about it. About exercise capacity. Oh, sorry. In here is done exercise capacity. Sometimes if your patient is taking beta blockers, particularly the peak exercise heart rate achieved during a standardized exercise stress test should be used to establish exercise training intensity. If the peak exercise heart rate is not um, available, the resting perceived exertion should be used. So it's important in here. And post-exercise blood pressure is another important consideration for medication, because anti-hypertensive medications such as alpha blockers, calcium channel blockers, and vasodilator may lead to sudden exercise reduction in post-exercise blood pressure. So termination to exercise should be gradual, and the cool down period should be extended and carefully monitored until blood pressure and heart rate return to near resting levels. And in here we have three factors when to refer to a provider, a physician, according with the ACSM guidelines. First, individuals with worsening blood pressure control despite medication adherence. Number two, individuals with a new onset signs or symptoms suggestive non-underlying cardiovascular, pulmonary, or metabolic disease. And three, individuals with clinical and or medication related questions that are outside the experienced professional scope of practice. Well, we have the case study here about hypertension. We're going to check it in class. We had the medical history in here about mismention. We had the factor about the diagnosis of hypertension, and we're going to check the exercise prescription to answer these three questions in here. The first one, we have it. You can see it in the screen. We're going to discuss this in class. The next one we have in here. We're going to check it and discuss it in class. And this one is the number 3. Well, this was hypertension.